also for having an opportunity to take a few minutes and talk to you a little bit about the mental health levy, issue 51, that will be on the ballot November 6th. Again, like the seniors, this is a straight renewal. There are no increases in taxes involved for you. But let me just give you some sense of what this levy provides or what it pays for. My organization, the Mental Health Recovery Services Board, really is the local management organization that funnels all of our public mental health dollars that come into the system. We receive federal dollars, we receive state dollars, and then these levy dollars. And these dollars then are my responsibility, our organization's responsibility, to make sure that Hamilton County residents who can't afford mental health services can access the needed mental health services. We don't do that through direct operation of the services. We actually contract with 36 agencies in our community to provide the services, and you may have heard of many of these: Central Clinic, Albert House, St. Joe's Orphanage, both adults and children who are receiving these mental health services on a regular basis in many cases. The situation in terms of our caseloads, I think, has been pretty dramatic, and I would attribute to, I think, that to more awareness of mental health issues, but some of the economic issues and other things have taken a really strong toll on our families. We've actually seen over the last 5 years about a 16% increase in the demand on our services. And so it's been very difficult in terms of trying to meet that need, but we think it's critical for our young folks and our adults who come into our mental health system to receive the services. The services that are paid for with that levy are ones that you would probably, at least first glance, understand some of those: counseling services, medication services. Many of our clients need to see their psychiatrist or physician to receive medication on a regular basis. Case management services, where we actually have people in the field working with, usually in many cases, severely mentally ill folks to provide the services for them. And so these services are provided that are, I think, ones you would respond to, but there's also others: housing services, employment services. One of the things that's really dramatic, I come and do this every 5 years, but the advances that we've seen in the mental health arena, I think, have been very significant. People are getting better, they're recovering. So access to housing and to employment are very critical for many of our clients who want what you want: a safe place to live, a job, friends and family close to them. So please support our issue. It's, again, issue 51. Cost to taxpayers about $48.38 per 100,000. That is the same as it costs at this point. Again, no increase in taxes for you. Be more than happy to answer any questions.